shocks I'm going to go over is distributive shock. It's essentially poor vessel function. There's three different types, if you want to say, of distributive shock. The first is sepsis. Sepsis is basically severe infection throughout the body. To decipher sepsis, distributive shock between hours, it's basically the patient will have a fever because of the infection in the body, and there's anaphylactic shock, which basically me and Brianna went over that in part 1, where there's an allergic reaction to something in the body. It could be either food related, medication related, insect related, or any other allergies that cause allergic reaction inside of the body. So with the anaphylactic shock, the bronchi and the lungs have trouble breathing because everything starts to constrict, and we can combat that with epi or EpiPen. The last one for a subcategory is neurogenic shock, and that's basically an injury to the spinal cord or central nervous system. When this injury occurs, it causes impulses to go sporadically throughout the body when there's no rhyme or reason for it. Also, if you have an injury to your spinal cord, it can cause spinal fluid to go into void spaces where you don't want the spinal fluid, and that will give your body issues. And the way I remember distributive shock really is the vessels become leaky in the fluid, and so if your car is leaking oil or leaking something that it's not supposed to, it's going to ultimately cause issues for your different issues in your car if you do not get it taken care of. Treatment for sepsis is basically if it's a long transport or you're not close to the hospital, contact ALS for intercept, because they're able to give more antibiotics and stuff en route to the hospital to get it started, and perform good ABCs on the patients. Anaphylactic, like I said before, you can give the patients epi or help them with their EpiPen, and that basically relaxes the smooth muscles in the lungs and chest to open everything back up to normal. And then for neurogenic shock, obviously if there's an injury to the spinal cord, you're going to have a good patient assessment where you're going to hold C-spine or put a C-spine collar on them. Contact ALS probably for a transport if you're far from a hospital. Treat ABCs very well for all three of these, like I said before, and just create a good patient assessment so you can determine the difference between the shocks and treat them with shock management. That is all I have for distributive shock.